Hello. This presentation introduces the concept of automated empathy, which is the underlying component of interactive voice response systems, which is what makes them more effective because it helps satisfy the patient's need to feel cared for. We all know it's not humanly possible for healthcare providers to personally call or email their patients as frequently as they would like to. And so this new concept enables providers to extend their reach and monitor their patients more frequently, which is an extremely important element in our new value-driven health system in which providers must demonstrate good patient outcomes. Automated empathy has the ability to make patients feel like they're being cared for when a provider doesn't have time to personally check on them. One of the greatest concerns expressed is whether this concept is even possible. The definition of empathy has been described as an effective response more appropriate to another situation than one's own. The program designers began with a concept called journey mapping, which is where they track a patient's experiences from the beginning of a healthcare encounter until the discharge from the system. This is tailored to the different patient experiences and environments. So with these different systems, no matter which environment they're intended for use for, the main message is we're here for you, we care about you, and we want you to get better. I had never heard of an empathologist before, but evidently empathologists help healthcare providers write scripts that will best describe their messages that they want to convey to their patients. The messages can be sent out by text, email, or phone. And on this slide, what I've done is tried to create what one of those messages by smartphone obviously would look like. The system is set up so that if a patient answers yes to a question, it can trigger a response or a phone call. Interactive voice response systems have many potential applications depending on what scenario you're looking at. One of those is chronic disease management. And with that, messages can be sent out asking about blood pressure readings or blood glucose readings. A message can be sent out letting a patient know that they need to go have labs drawn and call to make an appointment. Another one of the most notable applications that I've read about is tracking post-operative complications. Messages are sent out at specific intervals which correlate with known complications after surgeries. One story which seems to have circulated virally is about a man who had undergone a knee replacement and answered yes to a question regarding pain in his calf. And this answer, of course, triggered an immediate response which culminated in his being treated for a DVT. Currently, healthcare providers may see an enormous number of patients, requiring a mountain of charting, and it's very difficult to monitor them. Especially after they leave the office, which leaves some healthcare providers wondering how their patient is doing after they leave the office, but they don't have time to check on them. Health information technology may enable healthcare providers to extend their reach even though they don't have a lot of time. Interactive voice response systems utilizing automated empathy are available through several vendors. On this slide, I've attempted to create a very rough example of what a healthcare provider might see from their end. Providers can see a dashboard with a list of their patients that's viewable on a smartphone, tablet, or a laptop. The dashboard contains information about whether a patient is responding to their messages, as well as alerts for issues which might need to be addressed immediately. Interactive voice response systems count towards technology utilization which meets meaningful use requirements. Utilization of an automated empathy system will definitely change the way that we provide care and may change the dynamics of the provider-patient relationship. This system enables providers to track all of their patients while freeing them up to spend time to focus on the ones that require more hand-holding. And I can see feeling a sense of relief knowing that you're more aware of impending issues and able to mitigate these problems before they become too severe. So some of the benefits of using automated empathy technology are happy, healthy patients. So far, patients appear to really like automated empathy systems and are demonstrating more engagement in their healthcare. And studies are showing that engaged patients are more inclined to follow their treatment plans. As I mentioned before, these systems qualify as innovative healthcare, which means increased reimbursements. Thus far, data is demonstrating an improvement in quality and a decrease in readmission rates, which is extremely important due to the fact that hospitals will soon be responsible for patients' outcomes for 90 days after the discharge. These programs enable providers to keep track of their patients' progress with fewer phone calls. One study even suggests that phone calls from patients had decreased by as much as 70%. More benefits of using this technology. Data is showing that 81% of patients claim that the automated empathy messages have improved their opinions of their provider. Studies are indicating that 65% of patient satisfaction is due to the level of perceived physician empathy, and empathetic providers make more money. Automated empathy programs may actually improve patient-provider relations by enabling the provider to extend themselves beyond what is humanly possible. Satisfied patients improve HCAHPS scores, and one provider is quoted as stating that Health Loop saves lives, and he's referring to the way in which the program had helped him to catch complications with his own patients before they became too severe. Automated empathy programs are currently being piloted in as many as 40 different organizations around the country, including Kaiser and the Cleveland Clinic. These programs continuously collect data with regard to patient engagement and clinical outcomes, which can then be used to show meaningful use and positive outcomes. Some potential risks of using automated empathy technology surround the fact that it is unknown territory. All of the kinks have not been worked out. Even though this program is accessible by phone, email, and text, there are still going to be patients who are not computer literate enough to use it. There are concerns regarding HIPAA violations and many issues related to security, privacy, trust, and organizational dynamics, which need to be worked out. As I mentioned earlier, these programs can change the dynamics of the clinician-patient relationship, and this concerns many providers, even though they realize that they can't humanly care for patients at the rate that they're doing at this time. Automation also has its downsides if it's not implemented in an intelligent way. Instead of creating value and quality, it could marginalize healthcare. There are many unintended consequences which have yet to be discovered. There is the potential for an increase in the number of phone calls or receiving unwanted phone calls from certain types of patients. This slide was just a humorous way of illustrating some of the potentially negative consequences of automating empathy. So, potential policy changes required for the implementation. Many of you will recognize the symbol, the PDSA cycles. And it, I have a feeling, will play an enormous role in the implementation of any automated empathy system. As I mentioned earlier, there are several pilots programs that are ongoing and collecting data, trying to work out some of the kinks. One huge policy change which would be required is opening up two-way communication channels. This alone could create a few unwanted consequences, which is why having a protocol in place for handling adverse events would be wise. I spoke earlier about unwanted or negative commentary, which is another issue which needs to be planned for in advance. Boundaries need to be set up front because patients must understand that healthcare providers should not be required to be available 24/7, and they also need to understand what is considered to be inappropriate correspondence. Decisions will need to be made as to how many messages will be sent out, how often they'll be sent, and what content they will include. There also needs to be a policy in place updating the consent program. Patients need to consent to participate in the program, and the consent needs to outline the benefits and risks involved in participating. So, as I said before, this is unknown territory. One of the greatest challenges is how to figure out the best way to keep the patients engaged with effective, meaningful, and frequent messages without causing them to become saturated and disengaging. How do we know how many messages to send and what they need to contain? How does patient demographics affect the messages? I found a fascinating article which discusses the concept of the point of indifference and how it applies to conversational cadence. The author discusses a German physician, scientist, and inventor, Karl von Weroert. He invented the sphygmograph, and he discovered Weroert's law. This author also quoted the French composer Claude Debussy, who said that music is what happens between the notes. And it suggested that if you use Weroert's law to find what matters the most to the patients between the visits, at just the right cadence and with just the right content, to make the frequent messages effective and meaningful and relevant for the patient. I believe that automated empathy has the potential to be an indispensable tool enabling healthcare providers to extend their relationships with their patients outside of a single encounter, which may contribute to improving clinical outcomes. So, thank you for watching my presentation, and please let me know what you think. The next slides are all the references.